Aloha, welcome to the Sports Medicine Clinic. My name is Dr. Joshua Peiper, and today I am going to demonstrate a self-myofascial release and muscle energy technique for the glute med and the glute min. The glute med and the glute min are both abductors of the hip and leg, meaning they move the leg away from the midline or center line of the body. Both of these muscles are also responsible for stabilizing the body during walking and running when the body is in a single leg stance. When these muscles are dysfunctional, they can lead to low back pain, pelvic pain, and hip pain. The glute min specifically has myofascial trigger points that has a pain referral pattern that mimics sciatica, traveling from the hip down the leg into the calf just above the ankle. To achieve the ischemic compression component of this technique, we are going to apply force to several tender spots or myofascial trigger points within the glute med and the glute min for 20 to 30 seconds or until the discomfort has become less intense. To achieve the self-myofascial release component of this technique, we are going to apply force directly into the fascia in the area of the glute med and the glute min for 1 to 2 minutes. So again, if we treat 2 to 4 myofascial trigger points with the lacrosse ball, we'll have applied direct force into the glute med and glute min for about 1 to 2 minutes. When performing this technique, it is important to note that you should not apply direct force to the trochanter with the lacrosse ball. Again, the trochanter is the hip or femur bone that sticks out on the side below the top or crest of the pelvis. The glute med and the glute min are going to occupy a space on the lateral or side of the pelvis and are going to be bordered at the top by the pelvic crest, which is the top of the pelvic bone, and bordered at the bottom by the trochanter, which is that bony prominence or landmark that sticks out at the side of the hip, which is a part of the femur or the upper leg bone, right? So the glute med and glute min are going to be above the trochanter and below the pelvic crest, and then bordered posteriorly or on the back by the PSIS, which again is that bony landmark that pokes out at the very top of the hip in the back, and in the front by the ASIS, which is the bony landmark or prominence that pokes out in the front at the top of the hip. So again, glute med and glute min are going to be in between these two bony landmarks from front to back. So we're going to start by putting the lacrosse ball right outside or lateral to the bony prominence in the back, which again is that PSIS. So we're going to bring the ball just outside or lateral to that bony prominence and below the pelvic crest. So we're going to place the ball right there next to that bony prominence, and then I'm going to turn at about a 45-degree angle to the wall so that I can apply force into that area of the glute med. So just forward or anterior of that bony prominence, you should run into your first trigger point, which is one of the glute med trigger points. So I'm going to pin that down until it becomes less intense, that discomfort. So it should take about 20 to 30 seconds, and when it does become less intense, I'm going to move the ball slightly forward, and I'm going to continue doing that until I find at least 2 to 4 trigger points. For the muscle energy technique, we are going to do one of 2 versions of the single leg over. So the first version is a seated version, so we're going to take the leg on the affected side that we want to treat the glute med and glute min, and we're going to cross it over the unaffected side, or the side that we are not treating. So we're going to counter rotate the body towards that knee and use the contralateral or opposite arm to block the knee off. So we're going to take the contralateral arm and we're going to pull the knee across the body until we feel our first sign of resistance within the glute med and glute min. We're going to hold this barrier for 10 seconds. Once that time has elapsed, I'm going to contract the glute med and glute min, pushing the knee out into the back of my arm. But I'm going to use the arm to prevent the knee from moving, creating an isometric contraction. So I'm going to hold this contraction, that's about 10 to 15% of my strength, for about 5 seconds. So after that time has passed, I'm going to relax for 1 second, and then again with the arm, I'm going to drag the leg across the body until it gets to the next barrier. Once we get to this barrier, I'm going to hold it for 10 seconds. And then again, I'm going to contract both the glute med and glute min by pushing the knee into the back of the arm for 5 seconds. After that time has passed, I'm going to relax for 1 second and pull the knee or leg across the body until I get to the next barrier. All right, so this stretch can also be performed supine. So I'm going to lay supine. I'm going to take the leg and bring it over the opposite leg until it gets to the first barrier. So I'll hold this first barrier for 10 seconds. Then I'm going to use the opposite of contralateral arm to block off the leg, and with 15 to 20% of my strength, I'm going to try to return the leg back to neutral while preventing that with the arm. So I'm going to hold this isometric contraction for 5 seconds, then relax for a second, and then pull the leg to the next barrier if necessary. When performing the muscle energy techniques, you want to perform 3 to 5 of those cycles to fully inhibit the trigger points and lengthen those